Good morning, and thank you all for being here for another community update about the novel coronavirus and COVID-19, the disease that it causes. First, there remain no known community-acquired cases of COVID-19 in Lincoln or Lancaster County at this time. A fifth presumptive positive case in our state was reported yesterday. As we announced this morning, a student from Crofton in northeast Nebraska who attended the girls' state high school basketball tournament two games in Lincoln last weekend, has been diagnosed with COVID-19. The student, who had underlying medical conditions, is being treated at the biocontainment unit at UNMC. We do not know at this time how that student contracted the virus. The student arrived in Lincoln the evening of Wednesday, March 4th, and stayed with relatives through late Friday morning. He did not stay in any hotels or eat at any restaurants. He did attend 2 tournament games on Thursday only: the 9 a.m. game between Hartington and Weeping Water at Lincoln Southwest High School, and the 7 p.m. game between Crofton and BRLD at North Star High School. It is reported that the student went onto the basketball court after the morning game to hug family members. The Lincoln-Lancaster County Health Department is the lead agency in our community for preparedness and response. At this time, our interim health director, Pat Lopez, will update us on the steps being taken at this time.
Good morning. Our health department has made contact with the students' Lincoln relatives. They are now in self-quarantine until March 20th. The relatives are not ill and they are not showing any symptoms at this time. His relatives who do not live in Lincoln are also in self-quarantine. At this time, our health department is gathering the factual information and investigating any other potential contacts the individual may have had in our community. We are also communicating with Lincoln Public Schools, the NSAA, and our other community response partners about next steps. After careful consideration, the health department is recommending that the NSAA sponsored Boys State basketball tournament be an event that is not with spectators, that we only have immediate family members.
At this time, I'd like to ask State Commissioner of Education Matt Bloomstead and our NSAA Executive Director Jay Beller to please come forward to elaborate on the next steps with this recommendation to limit the attendance at the boys' state tournament to immediate family members only.
Yeah, first of all, I just want to thank the mayor of Lincoln, the city of Lincoln, the health department. A lot of different conversations obviously go into a decision of this with this type of ramification. First of all, the decision to proceed with the state basketball tournament to a certain extent, or the recommendation to proceed with the state basketball tournament, is to recognize the fact that students have worked hard to be part of this. Districts are working hard to be there. The reality to not include as many spectators and to limit spectators to immediate family only is to ensure and try to protect public health and the spread of the coronavirus across the state. Obviously, the importance for school districts to be able to retain and maintain a sense of normalcy around operations is being challenged on a constant basis, and we're taking lots of questions, lots of different things. Canceling a large event like this is about public health. It's about ensuring that we don't create an environment that actually makes it worse for the state of Nebraska, makes it worse for our vulnerable populations across the state. And I believe this is absolutely the right call, the right approach to take. I appreciate everyone's conversations on these fronts. This is a quickly developing type of event, but it's important that we get this message out. I also want to say thank you to Jay Beller and NSAA. I know they're in the middle of the challenge of trying to address this type of recommendation. I appreciate their dedication, their leadership, our school leaders across the state, for ensuring that we're thoughtful about what's good both for public safety and for our students across the state. So I thank you for that, and I'll actually go ahead and turn it over to Jay Beller for his final comments.
Thank you, Matt, too. And I want, on behalf of the NSAA, to thank everybody that had part of this discussion. I know it's changed very rapidly. And so from the standpoint of the NSAA, we're going back to our office right now. We have a board meeting that was in progress that we halted, that we're going to get back into, and try to figure out to the best of our ability the logistics of what this tournament's going to look like. We are very saddened that it can't go on with all the fans there, but we do realize that this is the best thing to do. So to tell you what it's going to look like at this point in time, probably premature, but as soon as we know, we'll get that out to everybody. So thank you.
I'm going to ask our interim health director, Pat Lopez, to come back up and discuss more about how we can all take precautionary steps to limit the spread of coronavirus and what to look for to help assist in that process.
I really appreciate, I think everyone, the work that we've been doing and the great communication we've had in trying to do the best possible thing for our community and the public and our vulnerable populations. So just to reiterate again, the symptoms of COVID-19 include fever, cough, and shortness of breath or difficulty breathing. Those who experience these symptoms should self-quarantine and call their healthcare providers for recommended follow-up. If you need help accessing care, contact the health department at 402-441-8006. Do not go to the emergency room unless essential. Emergency rooms need to be available to those that have critical health needs. If you have symptoms like cough, fever, or other respiratory problems, contact your regular healthcare provider first for instructions. We recommend people at higher risk of severe illness stay home and away from large groups of people as much as possible. Those most at risk include the following: those over age 60, those with underlying health conditions including heart disease, lung disease, or diabetes, those with weakened immune systems, and women who are pregnant. Even if you are not ill, avoid visiting hospitals, long-term care facilities, or nursing homes to the extent possible. If you do need to visit one of these facilities, limit your time there and keep 6 feet away from patients. This is for their safety. The health department continues to monitor the situation 24 hours a day, 7 days a week. We have measures in place to detect any cases quickly, to minimize transmission of the disease, and to guide our community's response. I'm going to turn this back over to the mayor for some closing.
Even as we continue to come back to you with updates, our message remains clear. We continue to urge everyone to do their part and follow common sense practices to prevent the spread of COVID-19. Those practices include staying home if you are sick and keeping your children home if they are sick. Social distancing will help slow the spread of the virus and help protect others who may be more vulnerable to it. Please wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use a hand sanitizer with at least 60% alcohol content. Cover your nose and mouth when you cough or sneeze, preferably with a tissue that you then discard. Avoid touching your eyes, nose, and mouth. And please greet others with a smile rather than a handshake. Employers should continue to take steps to make it more feasible for their employees to work in ways that minimize close contact with large numbers of people. It's important to understand that we will need to anticipate changes to our routines, that we may be inconvenienced in the coming weeks. That's part of doing our part to protect ourselves and those around us. It's good to think through now what you might do were schools or businesses to close or events to be canceled in the future. Again, here are the 3 key reasons why it's so important that we all do our part and take these recommended precautions seriously. First, there's no vaccine for the novel coronavirus and no one is immune. There's no vaccine or antiviral treatment yet available, though people are working on that. By delaying the spread of the virus, we protect our healthcare system. We want to continue to ensure that we are doing everything we can to keep the healthcare system from becoming overburdened by a sudden spike in cases. Many of us are not in the high-risk group of individuals, but if we do contract the virus, and even if we have mild symptoms or no symptoms, we could expose someone who is at risk to a serious illness. And that's why prevention steps like washing your hands frequently and for 20 seconds at least remains critical for all of us. We continue to work closely with our community partners, many who are up here with me and others who are in the room, and I want to thank all of them for their collaboration and continued focus on protecting our residents' public health and safety. I think at this time we have a number of folks who are here to answer questions. If the media would like to ask questions, we are ready to tackle those ourselves or in conjunction with our community partners. Questions? Okay. Right. As we're all aware, this is a rapidly evolving situation, and I'm going to ask Jay Beller, the Executive Director of NSAA, to come forward, but I suspect that that is something that will be coming later this afternoon.
Yeah, we've already talked about that a little bit at this point in time. I think we're going to have to defer to our schools that are playing, their administration, and people know who should be let in and who should not be let in. Immediate family gets to be pretty easy. I don't think that there's going to be tons of people from each. If you have 14 players, there's going to be a limited amount of people in there. And so we're going to rely heavily on the school officials to help us with that. Yes?
Can you tell us who you're considering immediate family, and would that have prevented this student from Crofton from being at the girls' stadium?
Yeah, I have no idea who the student from Crofton is or anything like that, but and we will discuss what immediate family is too. I don't know at this point in time. Yes.
Will credentialed media be allowed into the tournament this weekend?
Good question. That's something else that's going to be coming up. I'm telling you, I don't have a lot of answers right now because the curveball has been thrown, and we'll do the best we can to, as soon as we know, to get the information out to people.
Is the city going to do anything about people who are coming in from out of town to repay them for their hotels or costs or something like that?
I don't have an answer to that question at this time. This was a very recently made decision to make this recommendation to protect the health and safety of our residents. Pat, did you want to?
Yeah. I think we'll continue to work on that. As everyone said, this is really rapidly evolving, and we wanted to get out the information we currently have to you as soon as possible. So we've tried to be very transparent and provide the information, but we have to work out some of these details.
What about some of the families who may be traveling today because it does start this weekend? I mean, is there anything we can kind of tell them about this?
First of all, that's why we are working so hard to get this message out as quickly as possible, because we know across the state that you may have people driving here or coming here, and gives them an opportunity to change their plans and address this. So that's why we're trying to get this information out as quickly as possible.
What about other events? For instance, there's a concert at Pinnacle Bank Arena tonight.
We're looking at that right now. We haven't made a decision about that, and we'll let you know as that information becomes available. But each event we're looking at based on what the risk is in the community and to those attending.
Why was this the best decision to make, as opposed to canceling the tournament entirely or not having any fans at all? Why was this the best decision to make?
Because it created the least amount of exposure outside of, into the community and for all the others traveling here. We made that recommendation after very careful consideration.
Can you clarify, was this an order or a recommendation that the NSAA accepted? How would you categorize this change in how the tournament's going to go on?
It was a recommendation from the Public Health Department that we all discussed and came to agreement on to do the best job possible to protect the people in our state.
Some viewers are already asking if there's gonna be more games on TV now because of this. Do we have any idea about that?
That is one of the things we're working on right now, is to get all of those games televised so that people can watch them remotely, whether it's in a hotel room here in Lincoln or back home in their communities. We're undertaking those efforts to try and make sure everyone can still view the games. And to ask your question about why this, why this recommendation, along with the public health facts that are driving it, a recognition that the students have this opportunity to play, and that there's no sense of the ability to postpone indefinitely the tournament. If we have to, we will, but that is not at this time deemed necessary. But they're here to compete, and if we can allow them to compete and participate in this important life event, we want to support that. And by allowing immediate family members who want to be there, that it was really thinking about the children and their families, along with our public health facts.
It's still on the table to postpone or cancel the event overall. What would be the things that would need to occur for that to happen?
I don't think we have an answer to that at this moment. I'll ask Pat Lopez to step forward. But again, this is a rapidly evolving situation. With the facts that we have now, the Public Health Department is comfortable with this recommendation. And I think all of us are trying to maintain a sense of normalcy and calm and make the best recommendations with the information and facts that we have available in the moment. Everything is, of course, evolving and subject to change. I just want to acknowledge that. But we're doing the best we can with the information that we have.
I really don't have anything else to add to what the mayor's comments were. That is what is happening. I mean, things evolve in an hour or 2 hours. So this is the best recommendation we have at this time.
You've been monitoring this closely for a while, obviously, but
Yeah.
was the fact that this exposure specifically occurred at girls' state basketball, was that the tipping point to make this recommendation?
That really came into consideration for us, and the large number of people that are coming, the large number of potential vulnerable people in the population that are spectators. And so we want to minimize that. As the mayor said, we're trying to not increase the spread across the state. We're still trying to contain it as much as possible at this point in time.
This might have already been asked, but do we know how many tests have been done in Lincoln for this?
I don't have that number with me, but I can get back to you. We would have a number, but I just want to mention about the tests. We now have other labs that are doing testing, so we're working through that process. Even we have more tests available, but I really am strongly urging people to contact their healthcare provider and not just come to a lab and want to have a test go in, because there are certain parameters, and that's allowing us to know what's happening in the community, even though the labs report to us.
Are there any tests out right now of possible cases locally that are waiting confirmation or anything?
No, not in Lincoln.
Was there, I see the schools folks are sitting right in front of me, were there extra things done at North Star and Southwest, like to disinfect or clean after those games?
Dr. Joel with LPS is here with us, and we'll invite him up to respond to those questions regarding the district.
Yes, with regard to the question about disinfection, we've ramped up our efforts to disinfect any of the areas that have been designated as common gathering areas, and that would include where the tournaments were played last week.
Should there be any concern for LPS schools that they won't be open once they come back from spring break?
Well, as I stand here today, we're intending to have school when our students come back from spring break. However, we've been developing contingency plans in the event that we don't. And I'll thank all of our team folks and all of our teachers and administrators, because I think we've all put that what-if scenario into our minds. But right now, we're intending to have school, and we don't really see a reason to not have school coming through spring break. And as I mentioned at the last press conference, having spring break this week has given us an opportunity to really look at our systems and our processes and create viable plans.
And what is the plan if it does get to the point where you won't have school?
Well, we're equipped to develop, we have curriculum in place that can be delivered via technology. And, we know that that's kind of what we've been gearing up for. We use it an awful lot right now. Of course, with that come challenges. Not all of our families have Wi-Fi access. So, we're looking at developing an opportunity for our staff to create, make copies of materials. We know it's going to be a challenge if, in fact, we're put in that position to do it. But again, I want to emphasize right now, school's on next week.
That begs the question for the university too, if they're here, about what decisions they may or may not.
Do we have UNL representation here today? I'm not sure that they were able to attend. Apologies. If you want to let us know your question, or we can try to help facilitate.
Have you been able to directly define immediate family yet? Does that just mean parents, siblings? Have you been able to come up with who exactly that is?
Once again, I would say, and this is subject to change too, that we're talking about households. If they're in that household, they're more than welcome to come, and if not, we'd ask them to stay away.
Do you have any questions for any other of our community partners? Yes, sir.
Lancaster County Medical Society is very appreciative.
Oh, why don't you come on up? Thank you, Dr. Rapp. Dr. Michael Rapp is here.
I just want to say that this is a very courageous and timely and important decision that everyone needs to appreciate. This is, in my opinion, a pan-epidemic, and it needs to be treated as such. And I'm speaking personally now, Dr. Joel. Thank you for watching this carefully, and please show the same level of courage to protect our kids. Thank you.
Are there any more questions, either for the city, the educators who are here, or our community partners who are here? Okay, we will continue to keep you informed as the situation evolves. Thank you.